much of Europe, the virus is spreading even faster than the reasonable worst case scenario of our scientific advisors, whose models, as you've just seen, now suggest that unless we act, we could see deaths in this country running at several thousand a day, a peak of mortality, alas, bigger than the one we saw in April. And as you've just seen, even in the southwest, where incidence was so low, and still is so low, it's now clear, though, that the current projections mean that hospitals in the southwest will run out of capacity in just a matter of weeks unless we act. And let me explain why the overrunning of the NHS would be a medical and a moral disaster beyond the raw loss of life. Because the huge exponential growth in the number of patients, by no means all of them elderly, by the way, would mean that doctors and nurses would be forced to choose which patients to treat, who would get oxygen and who wouldn't, who would live and who would die. And doctors and nurses would be forced to choose between saving COVID patients and non-COVID patients. And the sheer weight of COVID demand would mean depriving tens of thousands, if not hundreds of thousands, if not millions of non-COVID patients of the care they need. And it's crucial to grasp this, that the general threat to public health comes not from focusing too much on COVID, but from not focusing enough, from failing to get it under control. And if we let the lines on those graphs grow in the way that they could and the way that they're projected to grow, then the risk is that for the first time in our lives, the NHS will not be there for us and for our families. And even if I could now double capacity overnight, and obviously I'm proud that we have massively increased capacity. We do have the Nightingales. We've got 13,000 more nurses now than we had last year. We've got many more doctors. But it still would not be enough, because the virus is doubling faster than we can conceivably add capacity. And so now is the time to take action, because there is no alternative. And more nurses now than we had last year. We've got many more doctors. But it still would not be enough, because the virus is doubling faster than we can conceivably add capacity. And so now is the time to take action, because there is no alternative. And from Thursday until the start of December, you must stay at home. You may only leave home for specific reasons, including for education, for work, let's say if you cannot work from home, for exercise and recreation outdoors with your household or on your own with one person from another household, for medical reasons, appointments, and to escape injury or harm, to shop for food and essentials, and to provide care for vulnerable people or as a volunteer. I'm afraid non-essential shops, leisure and entertainment venues will all be closed, though click and collect services can continue and essential shops will remain open, so there's no need to stock up. Pubs, bars, and restaurants must close except for takeaway and delivery services. Workplaces should stay open where people can't work from home, for example, in the construction and manufacturing sectors. Single adult households can still form exclusive support bubbles with one other household, and children will still be able to move between homes if their parents are separated. If you're clinically vulnerable or over the age of 60, you should be especially careful to follow the rules and minimize your contacts with others. I know how tough shielding was, and we will not ask people to shield again in the same way, but we are asking those who are clinically extremely vulnerable to minimize their contact with others and not to go to work if they're unable to work from home.